Hello everyone, it's just after 7 o'clock in Nairobi and you're just on time for your world this Monday, the 26th of April, a day after the world celebrated the International Malaria Day. Now, since the coronavirus pandemic first took the world by storm in early 2020, it has almost monopolized the world's attention. But this has taken the spotlight away from other diseases such as malaria. This morning, we take a look at Kenya's progress towards eliminating malaria and the challenges that lie ahead. My name is Victor Kiprop and this is Your World. Coming up,
malaria treatments.
The World Malaria Day was celebrated across the globe on Sunday. We focus on the gains so far in the fight against the deadly disease. A new malaria vaccine with 77% efficacy raises hopes for a major breakthrough in the fight against the deadly disease. Civil society organizations in Chad call for public demonstrations to demand the dissolution of a transitional military council following the death of President Idris Deby. And healthcare workers in remote Sudan vaccinated against COVID-19 as global vaccinations near the 1 billion mark. Malaria is one of the leading causes of death in Kenya, and that's what we're talking about this morning. And on our question of the day, we ask you, how can we completely eradicate this infectious disease? Malaria is one of the leading causes of death in Kenya. How can we completely eradicate this infectious disease? Be sure to be part of this conversation by tweeting us at NTV Kenya and at Victor Kiprop _ is the hashtag new normal. You could also follow the conversation on Facebook and Instagram. Later on, our lines will be open and you can call in or send a text message to be part of that conversation. But just before we get into it, let's give you an update of the coronavirus situation in Kenya and across the world. And these are the latest global numbers according to Corona Tracker. 143,542,550. That is the number of people confirmed with COVID-19 so far across the world. 122,151,796 people have so far recovered from COVID-19 across the world. But sadly, we've lost 3,057,541 people to COVID-19 so far. Let's bring the numbers closer home now. And in Kenya, according to the latest figures from the Ministry of Health, 152,523 people have been confirmed with COVID-19 in Kenya so far. 103,838 have recovered, and sadly we've lost 2,519 people to COVID-19 in Kenya. Of course, we continue to remind you to follow the protocol set out by the Ministry of Health, which includes sanitizing or washing your hands as regularly as you can, wearing your mask at all times, and maintaining the 1.5 meters social distance so that we could all play a part in controlling the spread of COVID-19 in Kenya. Just before we get into the conversation, let's give you an update of what else is happening across the African continent. And Chadian civil society organizations are calling for a public demonstration to demand the dissolution of the Transitional Military Council headed by General Mahamat Idris Deby, who took power this week following the death of his father Idris Deby. President Deby, who has been in power since 1990, said to have succumbed to wounds suffered during a visit to the battlefield in the country's north, where Chadian soldiers fought against a rebel group last Tuesday, a day after he was re-elected with about 80% of the vote. France and regional allies have backed the fallen president's son to take power, but the opposition does not want the former colonial ruler meddling in its affairs. And as COVID-19 vaccinations across the world near the 1 billion mark, healthcare workers in the remote northern Sudan, where medications and health services are often lacking, have not been left behind. The AstraZeneca vaccinations, which Sudan secured last month through the COVAX initiative, were handed out to health staff in the modest medical center of village of Sir, some 40 kilometers north of Dongola in Sudan's northern state. 2,300 people have so far died of COVID-19 in the country, with more than 33,500 cases of COVID-19 confirmed in the country so far. To West Africa now, and the coronavirus pandemic shut down Senegalese wrestling for a year. But now fighting is allowed again, a relief to wrestlers and spectators in this country where the sport enjoys widespread popularity.
Feet firm in the sand, they tackle each other again. Wrestling is back in Senegal for the first time in more than a year. The coronavirus shut down fights in March 2020. No more training, no more crowds, no more matches.
This caused a great deal of loss for everyone involved, because wrestling isn't just about wrestlers, it's also the teams and the entire economic environment that exists around the sport.
Wrestling is incredibly popular in Senegal, second maybe only to football. More than a game, it has cultural importance. It's rooted in harvest rituals of the local Sera and Jola people. It's also a source of employment. More than 8,000 people lost their jobs when COVID-19 struck. Not even the stars were spared. The wrestler, known as Umar Sene, couldn't wait to hear the crowds roar around the arena again.
If we only had to take care of our families in this time, it wouldn't be a problem. But others rely on us, with whom we have to share what we have. I'm very close to my fans, and I have a responsibility to support them. We've really felt the impact of the damage caused by the pandemic.
The 42-year-old ex-king of the arena dreams of retaking the title he lost in 2019. This means intensive exercise, but also some traditional security. The fighters wear charms around their wrists, ankles and arms. Almost no one can approach them before a match. It could spell bad luck.
All Senegalese people enjoy wrestling because we find ourselves in it. It's more than a sport. It's an entire cultural experience that is wrapped up in watching a wrestling match.
Mass protests shook the country in March, the worst unrest in years. Wrestling bosses say the return of fighting will restore Senegal's spirit.
Kenya held the African Rally Championship ARC Equator Rally over the weekend in preparation for the World Rally Championship WRC. Kenya is set to return to the World Rally Championship in June 2021 following a 19-year suspension from hosting the event by the FIA.
3, 2, 1, and off they go. Sean.
We've been rallying for 20 years, and it was a dream for WRC to come back to Africa and mainly Kenya, because for me it's a country that's very close to my heart as well. It's African Rally Championship. I've done it for many years, and it's good. The link is very beautiful. This is as important as the rally in June for us. It doesn't matter. Every rally is important. It's always some new experience, a better technique, improving the skills always, even after 20 years, I think. It's a pleasure, it's a fun. But of course, it's the same stages that we will have in June. So it's a recce.
It's been 19 years since we had the last World Rally Championship in Kenya, and a lot of work has gone in from the rally fraternity, from the government, from all the stakeholders to bring this event back home. And we're quite sure that all those who are coming for the WRC will enjoy themselves immensely. They'll meet the challenge, but they'll also get to enjoy Kenya's beauty and hospitality.
It's our first safari rally since 2002 when we were actually told to leave, and it has to be the best one ever, so that there's no doubt in anybody's mind that in fact Kenya is the rally country of the continent, it's the rally country of the South, and hopefully it will be the rally country of the entire globe.
Let's get you started with that conversation about malaria now with this story by Helen Aura, and with the theme for this year's World Malaria Day being zero malaria, I beg your pardon, draw the line against malaria. The Ministry of Health says that Kenya continues to make great strides in the fight against malaria, with the overall prevalence of malaria in the country having reduced from 8% documented in 2015 to 5.6%. The Lake region, which bears the highest disease burden, has recorded a reduced prevalence from 27% to 19% with the launch of the End Malaria Council this year. The government has also set to sell local manufacturing for the production of malaria control commodities, as Helen Aura now reports.
In a battle against a vicious but silent killer, Kenya can now chalk up a partial victory. The Ministry of Health says the country's prevalence had reduced by about 25%. According to the Kenya Malaria Indicator Survey 2020, malaria cases dropped nationally from a prevalence of 8% in 2015 to 5.6% in 2020. The cases reduced from 113 per 1,000 people to 86 cases per 1,000 people.
In the period 2015 to 2020, there has been increased ownership and use of bed nets by communities, as well as improved availability and access to recommended malaria treatments.
Cases in the malaria endemic zones of the Lake region dipped from a prevalence of 27% to 19% and from 8% to 4.5% currently at the coast region. The government says though the country missed its 2020 target of reducing infections and mortality by 40%, the country had made huge strides. But in an effort to further control malaria, at least 25 million Kenyans in high malaria burden counties are set to benefit from the distribution of 15.7 million nets. Further, only Kenya, Malawi and Ghana deployed the first vaccine against malaria. So far, more than 190,000 children have received the first dose since 2019. As part of Kenya's plan to eradicate malaria by the year 2030, the Ministry of Health says the introduction of the malaria vaccine in September 2019 is just a step in the right direction, with a pilot program being introduced in the 8 endemic Lake region counties.
The children are being vaccinated between the ages of 6 months and 2 years. The first dose they are getting when they are 6 months old, the second dose 7 months old, third dose 9 months old, and the last dose at 24 months old. And the most important thing about this is that we have integrated this vaccine with the other routine vaccines. So the children are not necessarily going out of the way, or the mothers are not going out of the way to get their children vaccinated. Also, there has been no adverse events or side effects from this vaccine.
The new vaccine that you have heard that possibly 77% efficacious from Burkina Faso, led by the Oxford University Group. This is possibly in the second stage of development of a vaccine, and this was the first basically proof of concept study that they did in around 450 children.
Despite the great strides, the ministry says it's still facing a funding deficit of 24 billion to fully implement the current malaria strategic plan from 2018 to 2023. Helen Aura, NTV.
Helen Aura there with a brief from yesterday's International Malaria Day celebrations, and I've got a very interesting panel ready to discuss with us the state of malaria, the state of the fight against malaria in Kenya. But just before that, let's give you some brief context with these numbers regarding the malaria situation in Kenya and across the globe. And globally, 3.4 billion people are estimated to be at risk of infection. In 2019, 229 million new infections were recorded according to the World Health Organization, and over 409,000 people died. 61% of the deaths are estimated to be in children under 5 years. And across the globe, of course, malaria kills one child every 30 seconds and about 3,000 children every day. Let's bring the numbers closer home, and about 37 million Kenyans are at risk of infection. I believe that is about 75% of the country's population. The experts in studio will be talking to us about that. It is one of the top 10 killer diseases, of course, and a leading killer of children under 5 years. And it takes a child's life, of course, after every 2 minutes in Kenya. And in 2019, it accounted for 3 for every 10 outpatient cases. All right, let's get some more numbers now. And 4.6 million cases, of course, were reported in Kenya in 2020. I believe these are figures from the Ministry of Health. And the burden is highest in the 8 counties around the Lake Victoria region. We'll also be talking about that in a bit because they account for 70% of the cases. And, of course, in 2020, we lost 12,652 people to malaria. Great. Let's get you started on that conversation now. I've got a very interesting panel, as I promised you. Joining us virtually this morning, Dr. Rudy Igas, the World Health Organization country representative. Welcome to the show, sir.
Good morning.
All right. Of course, joining us virtually as well as Roy Sasaka Chalewa is the National Youth Council of Kenya, also from the Kenya Malaria Youth Army. Welcome to the show, Roy.
Thank you so much, Victor.
Of course, and joining us in studio this morning with me in studio, Dr. Pacifica Onyanja, the Acting Director of Medical Service and Preventive and Promotive Health from the Ministry of Health. Welcome to the show, Dr.
Thank you so much, Victor, for having me this morning.
Asante. And also joining us in studio this morning, Chris Getonga, the Chairman of the End Malaria Council. Welcome to the show, Chris.
Good morning.
Good. All right. Let me start with you, Dr. Onyancha. Zero malaria, draw the line against malaria. That's the theme for this year's, of course, International Malaria Day celebrations. But one would argue that it's pretty much different celebrations from the other years, isn't it?
Yes, yes, yes. Draw the line. Victor, as you've already given the statistics, I think if you went back, a little bit back than that, we know that there's a time that malaria caused actually a catastrophe in the country, and not just in Kenya, but as a whole of Africa. And I think to take you back a bit is that actually the African state is the most hit, and therefore they started the day before it was adopted by the World Health Organization at the world and celebrated now world over. So because of that, we realized, and I think from the statistics you could see, that we are losing about over 12,000 people in a year to malaria, and therefore really, even as we do the efforts towards the pandemic, the corona, you see we are not yet there. So it is a disease that we really need to put a lot of efforts. And I'm glad from the statistics and yesterday's celebrations, you could see that yes, we are trying to embrace slowly the efforts that are being put to make sure that we eliminate. So drawing the line is that indeed it will always, you need to remind yourself that I must work towards elimination of this malaria, because really, especially the 8 endemic counties, if you said, for sure this is causing a lot of disease burden. And of course, with the limited resources, you can imagine then it is a bit difficult, and therefore there's a need for us as a country to work towards supporting especially that heavy burdened region.
And I take note of the fact that you mentioned I should take.
Yes, yes, yes.
Okay, that means everyone should take charge.
Me and you.
Okay.
Yes,
all right.
yes.
And let me just bring in Dr. Egas at this point, because 12,000, I believe 652 people, that's the number of people we lost to malaria in 2020 alone, and in Kenya alone. We don't talk about this enough, do we?
So this is clearly a disease that is causing a lot of hardship across the country, and it is something that can be addressed. There are means of dealing with this disease. Most prominently, of course, is the prevention of the disease through bed nets and now through the malaria, but also the treatment, the diagnosis of cases, the treatment, and then the public perception, as was said a minute ago. So there's a lot we can do still about the malaria problem in Kenya, and clearly it is an urgent matter.
Okay, but of course the key note from what you've just mentioned is that it is a huge figure, 12,600, but this is a figure we are talking about deaths that could be prevented, right?
Absolutely. So these numbers are very high, and with the use of the bed nets and the new vaccine, we actually do have the possibility to reduce them dramatically, and ultimately, as was said, we can get this to zero. There are other countries that have eliminated the disease, and Kenya is well on track to do so.
Okay, and maybe from a continental perspective, I believe these are figures from the WHO. 36 of the 44 endemic, malaria endemic countries did not achieve their 2020 milestones. I think it's only Botswana, Ethiopia, Gambia, Ghana, Namibia, and South Africa, of course, who were able to meet the milestones they had set for 2020. Does that worry a bit?
Yes, it is worrying. Obviously, the COVID epidemic has been somewhat a problem in this respect. So the focus of all the health systems, the health workers, even individuals in the countries have actually focused away from the malaria treatment and the malaria diagnosis. And so it is worrying that we are missing our targets. It doesn't mean that we will miss them forever. So basically, we need to get back into the track of following these cases, identifying the cases, and above all, preventing these cases. As was announced by the CS yesterday, I think the rollout of the malaria bed nets is really one of the big things that can be done even in the COVID period.
Okay, thank you. And of course, we'll be coming to what the government and partners like the WHO are doing to bring these numbers down. But let me just go to Chris now. Chris, we are one of those 33, I believe, 36 countries I mentioned that did not meet their 2020 milestones. Does that worry you? And number two, there are definitely some positives, right?
Yes, we did not make the target that we were supposed to have met, but we are about, I understand, 80% on target. And the End Malaria Council was set up to basically engage private sector with the government to bridge the gap that you heard yesterday was 24 billion shillings. And like Dr. Eggers is saying, that there's a lot of things that we need to help prevent malaria, which is the bed nets, and we were very happy that the rollout will start at the end of this month.
Okay. And let me just come back to you, Dr. Onyancha, because even before we go to exactly what we are doing and the progress we've made, let me take you back to the point I asked Dr. Eggers about that it's not talked about enough. Every time we talk about the deaths or malaria, it's always the impact, the number of people we are lost, the number of people we are sick. But there are other indirect, consequences. Children missing school, draining economies.
Victor, you're very right that indeed many at times we want to quantify the effect in terms of mortality and morbidity. But as you say, the economic impact, not just for children, but even the working group, because there are many days that are lost, and therefore economically is not really contributing. And therefore I think, and that is why we must speak about malaria. We must really own it at individual level, that, again, we make sure that the efforts that are put by the government, that it is for every person. Yes, we know that malaria may not be equally distributed in the country, but I think it is important for every person to contribute towards malaria, talking about it, because at the end of it all, even though it is concentrated in one region, one way or another, it affects every Kenyan because of the economic impact, the children who are missing school, and not just missing, but even the intellectual, because of when you look especially the complicated malaria, it has also a lot in terms of actually the capacity of this child, even after recovery, to be able to actually live to the full potential. Okay. So really, it is important that we talk about malaria and the ways we can eliminate. I'm happy that the Dr. Eggers says that there are countries who have eliminated. Why not Kenya? Okay. And of course, talking about malaria means that we all talk and be part of it. Let me just bring in Roy, who is, of course, leading the youth to actively participate in stopping malaria in Kenya. Roy, every year, of course, it's obvious, every year that we let malaria spread, health and development, and I want to come to the point of development suffering every time we let malaria spread. And Dr. Onyancha has raised the point about all of us, you know, being part of this fight, right?
Thank you so much, Victor. Picking from what Dr. Onyancha was saying, and I was happy when he was talking about everybody being involved, where we sit as the youth of this country, we believe that this is a fight that can be won. And the strategy, and I believe this is the way to go, is to harness our demographic dividend. We know that the youth are the majority in terms of our demographic dividend, and we are the majority actually in our communities. And that's why, as National Youth Council, we are actually extending partnership with the Ministry of Health, together with other partners across Africa in terms of this fight, because we believe that through serious advocacy and through making young people, the youth, as the youth armies to fight this malaria, we will actually win the war, and we'll draw the line, as Dr. Onyancha puts it. Because when you look at where the malaria effects are being felt most, we believe we have the numbers as young people, and we can do a lot of advocacy in ending malaria. We can actually do a lot of teaching and sharing, communicating information about malaria in our communities. And I think we're also in discussion with the ministry to see, from the minister's announcement yesterday, how do we engage young people, even in the distribution of nets? We are saying with our numbers, with our youth numbers, I think we can actually win this war in fighting malaria and actually achieving no malaria campaign in our country. Okay. Of course, we'll be coming to back to some of the campaigns you're setting up to make sure that the youth become part of this fight. But let me just go to Chris regarding the milestones that we mentioned earlier. I think he mentioned that we were 80% in our journey towards the milestone we had set for 2020. So for anyone, of course, who is watching, Chris, and they're a bit scared that there may not be any progress, are we making any progress? Because this is one of the oldest diseases I think we've been fighting since the 70s and the 60s.
Yeah, thank you, Victor. Like I said, just to echo what Roy is saying, the progress will be made because we've got this youth army that's available on behalf of the government to work closely with the Ministry of Health. And we've also heard yesterday from Dr. Aman that the Cuban government is going to help us in this fight against malaria. So I think we have all the resources. We have, like Dr. Onyancha said, we have the capability as far as the doctors available. And for us, as the End Malaria Council, is to engage private sector. And I'm appealing when we start coming out to you to help us bridge that gap. And that financial gap, like I said, is big. But you know, as you know, we need money to mobilize both the purchase of nets, the kits, paying the youth army. And I think we will be able to really narrow that gap over the next 1 or 2 years.
Okay. All right. Let me just go back to Dr. Eggers on something, of course, very critical to this conversation, and that the difference between how we've been fighting malaria in the previous years and this year is that we are actually fighting malaria this year when we are also in a pandemic.
Yes, that is quite problematic because, of course, the pandemic has overwhelmed everybody's focus. So the entire health service, of course, is now geared to actually try and deal with this epidemic. And it's difficult to compare the two diseases. The one is, of course, an old disease, a disease that's been there for a long, long time and has been killing people for a long time. Whereas this COVID disease, of course, is sudden and it's quite deadly as well. Now, if you start comparing the numbers, people will ask, well, why are we doing so much about COVID and so little about malaria? The fact of the matter is that the COVID numbers have been severely reduced, firstly, of course, by virtue of the implementation of the restrictions by the government. And of course, there's a lot of underreporting of the COVID situation. So it is really difficult to compare the two. The other thing that should be very evident is that we cannot stop treating the one disease while treating the other, because we know from other outbreaks, such as in Western Africa during the Ebola outbreak, that if we do not pay attention to the essential services and the diseases that are, in any case, killing Kenyans, they will actually revert back and become worse again. So we have to work on both diseases simultaneously.
Okay, all right. Dr. Onyancha, maybe from a government perspective and from Dr. Eggers said, we can't afford to lose focus on these other diseases. But just from where we sit as a country, have we had any impact, direct impact of COVID-19 affecting our malaria prevention efforts?
Victor, I'd say that yes, it has, such that from the beginning, you remember what happened. Most of us didn't know how to respond. There was a lot of fear. There was a lot, and also I want to also agree that with the Lagos that indeed we cannot afford to actually ignore the other diseases. So what happened that if you look at even the symptoms of the corona, they almost mix also like malaria symptoms, the issue of fever and all that. So initially, remember, we saw a drop in the actually seeking services of patients because they were fearing that when they go to hospital, they might get the COVID there. So that must have affected the malaria fight negatively. But with time, we had to come up with protocols on how to manage actually the other, to continue with essential health services, and that we have seen it peaking even as we monitor. So one of the things, of course, as you know, resources are not unlimited, and therefore a lot of resources, also both human and also of cash, is actually being directed to COVID. But I want to actually affirm that as a government, we have the National Malaria Program, which is really putting a lot of efforts to make sure that, yes, even as we respond to the COVID disease, we are not going to lose sight of the fight against malaria. And I am happy that the statistics you read, you can actually see very clearly that indeed a lot of effort has been made from 2015, which led to the reduction of incidence from 8 to 5.6. And we are actually trying very hard to make sure that we don't lose that. That is why, despite the third wave, we were able to celebrate the World Malaria Day yesterday in whichever form, so that we can tell the people that we are still on course and they should not lose it. They should continue fighting the two diseases.
Okay, and I was looking at the numbers for TB. Of course, I think for them the challenge was the similarity between the symptoms for COVID and TB. And there was actually a direct impact of people, you know, avoiding hospital and all that. Did we have this in the case of malaria?
Victor, as I said, initially we saw actually significant drop of outpatient services in facilities. And I want to believe that some of the people who were affected who could avoid going to hospital because of fear of contracting the COVID, part of it were malaria cases. However, we know that it again peaked very fast. It was reversed because of the interventions. So maybe we are yet to actually analyze the deaths from maybe last year. And I want to believe that that 12,000 for 2020 might have been that bad because of also the COVID. It must have been contributed because of the response to COVID and fear of going to seek treatment for COVID. But again, it's good to know that our people have actually now been able to really embrace the efforts that are being, the strategies of combating malaria, such that as you saw the minister yesterday said that we are seeing more and more people embracing sleeping under mosquito nets, using the proper medication as it is the regimen for malaria. So that really has also helped us to be able to fight. Even though we have not reached the target, 80%, we are not very far. I am confident that we'll be able to reach actually the targets.
Okay.
Especially.
We'll be looking at another challenge of climate change in a short while, but let me just go back to Dr. Eggers on this, because what you've mentioned, the issue about resources, trying to balance between COVID-19, you know, and the same resources have to be used with regards to malaria. What does this say about the issue of partnerships and bringing other partners on board, especially in terms of finding more resources, especially for malaria at this point, Dr. Eggers?
So in fact, the malaria program has been greatly supported by entities such as the Global Fund and USAID and PMI, and then of course by government itself. And these monies continue to flow, they continue to be used for the malaria program. And in fact, many of the partners have actually agreed to use additional money to actually support the COVID response. So you find, for instance, the Global Fund has agreed to add additional funding to support both the 3 diseases that it's supported, but then also the COVID outbreak. So across the board, really, we find that the donors are very cognizant of the need of simultaneously dealing with the COVID outbreak and making sure that there is funding for that, while at the same time maintaining the funding for the priority diseases such as malaria.
Okay, and of course, Roy has mentioned a gap of, I think, 24 billion shillings that is in the implementing the malaria strategy for Kenya, which I believe should reduce the people at risk by 75% by 2023. What we have noticed in the recent years, even before COVID-19, was there was some of these partners who were actually cutting funding. There was also a concern some times back that even the government itself was starting to cut funding on malaria. Let's just go back to the point of trying to maintain the balance of, you know, fighting maybe a pandemic and 3 other epidemics at one point.
So there are 2 things. The one thing is clearly it is needed that the domestic funding, the funding by government, should be increasing for these kind of diseases. That's true for malaria. It's true for the other diseases as well, HIV, TB, the vaccine preventable diseases. So Kenya, as it becomes economically stronger, will require also to put additional funding in its disease control program. So that is really important, that we look at the government as well to assure that the funding actually increases and not decreases. If we look at malaria specifically, we know that some of the areas of work within the strategic plan are reasonably well funded and others are not funded. So we really need to balance that out and make sure that the funding goes to all. I think the bottom line is, at the moment, the donors are continuing to provide support. This is both the financial support by the Global Fund and USAID and other donors. At the same time, they are calling the government to actually make sure that they increase their budget allocation to this.
Okay.
In the current context with the COVID outbreak, of course, that is a difficult balance to take. But nevertheless, I think both of them require additional funding. From WHO, we focus on the technical assistance, so that too will continue.
Okay. Let me just come back to you, Roy, because you're running a number of campaigns with regards to the youth. Does this, is, you know, attracting or increasing resources to fight malaria part of the campaigns that you're running?
Yes, Victor, I can confirm that when you're running campaigns, Victor, you can't, in most cases, successfully run them without resources. So for us, this is very critical. And because when you look at some of the campaigns we are planning, of course, together with partners across, they require resources, especially to push the campaign in the communities. Because we are looking at, even if we are engaging in the distribution, we are pushing, they may want also to be considered for a small stipend in terms of that, though that is not really the main agenda that we saw. But we believe that resources are very critical to the success of this campaign. And we are looking at ownership, more so ownership of the campaign advocacy agenda by the young people, where we are saying in our communities, the young people in the communities, do they own, as Dr. Onyanja puts it, do they own the advocacy agenda of ending malaria, because it's one thing to actually push for the resources, and it's another thing to actually own the fight as young people, that this is our fight and this is our legacy to make sure that we end this malaria in Kenya and also across Africa. And that informs why the youth armies are being set up in our advocacy agendas. And this is as a result of AU initiatives. Because as you are aware, Victor, our President Uhuru Kenyatta, His Excellency Uhuru Kenyatta, is the chair of Malaria Alliance in Africa. And when you look at it, the strategy is to have youth armies across all African states. That these are young people who are advocating to end malaria. These are young people who are going to sensitize the communities of malaria. These are young people who are going to distribute nets in the communities. And they're also going to use the innovativeness and communication skills in the digital space to create awareness about malaria, how to prevent, and also how to end it. So yes, resources are a very critical pillar for the success of this campaign and advocacy agenda.
All right. Of course, the other challenge other than resources is climate change. And we have this story that we prepared from Baringo County. And climate change is the reality that the world lives under today as it affects economies, infrastructure, and food systems. It is also changing the way in which diseases behave, especially those caused by insects such as mosquitoes. Bridget Ngana shines the spotlight on how malaria arrived in Baringo County, what climate change has to do with it, and why experts are worried that pretty soon malaria could be impossible to treat due to increased cases of drug resistance.
The expectant mother of 3 is part of a homestead which in 2019 was in the news after a malaria outbreak left 6 members of her family bedridden. Her mother-in-law died of what the family suspects was malaria. A few days ago, Janet had been hospitalized due to malaria, a disease transmitted through the bite of an infected female Anopheles mosquito.
Si hata niligonjeka hata mimi juzi, ikanibidi niende hata hospitali kutafuta neti, hakuna. Ingawa nilipata tu madawa, lakini naona tu mvua ikianza tena ikinyesha, sitakuwa tu bado ni ugonjwa iko tayari. Mimi sina neti, niko tu na 2, lakini niko na watoto.
Janet's sister-in-law recounts their horrific experience in 2019. The whole homestead was sick, and the only health facility, Marigat Sub-County Hospital, where they could get treatment, was kilometers away despite the neighboring Longewan dispensary, which at that time was not operational.
Malaria ni mingi, sasa ikichukua tu mtu yeyote hospitali anasema kana malaria, hata kama ni mtoto kidogo. Kwa 2019 watu walikuwa wagonjwa. Ikienda kupitia watu ni malaria. Sasa malaria ndio amepanda sana kwa hapa. Hakuna malaria mgonjwa nyingine.
As the headman of Loldama village, David Lesoita's home is ever busy.
Unaona sasa hii, sasa ukishaweka, sasa umekuwa safe. Kweli kuna wengine wanasema ukiweka net inachuna, wengine wanasema ni joto. Lakini
this father of 16 doubles up as a community health volunteer, and he too knows quite well how malaria affects the 60 households he supervises.
Ukishawakisha tu light, umbu unaingia kwa nyumba. Hata afadhali ile ya samani kwa sababu saa zingine watoto napiga, sasa iko moshi, sasa inafukuza umbu.
The Marigat Sub-County Hospital is the focal point of treatment for malaria in Baringo South. The hospital is well equipped with diagnostic test kits and treatment for malaria. The medical superintendent tells us that malaria here is either imported from other parts of the country or homegrown, owing to the area's proximity to lakes Baringo and Bogoria, which have since swelled and displaced scores of people.
The movement of people from malaria endemic zones like Trans Nzoia, Uasin Gishu, Kericho, and sometimes Nakuru. And also we have very many people coming from Western. So they all bring malaria to this place.
Dr. Kamau says residents hardly use nets and sometimes resort to traditional herbs to treat malaria.
The main challenge in treating malaria here is mainly we have had a problem with telling people to use mosquito nets because most people don't want to use mosquito nets because at night it's very hot here. Also, sometimes the nomadic communities around, it's hard for them to use nets. Also, when you treat them, sometimes it's hard to adhere to treatment because some also believe in ethnomedicine where they use traditional medication. Most of the children are affected by malaria a lot. Because among those age groups, you'll find that like here, their HB is low. And the biggest challenge is when they come with low HB, we need to transfuse. We don't have a transfusion center here. When there is an outbreak, sometimes we can see up to 50 children with malaria.
Dr. Onyancha, clearly the challenges are evolving and climate change is also becoming a new issue.
Yes, Victor. I think what you listen carefully the clip that you've just seen. One of the things that the lady is saying that when the rains come, we are expecting the disease again. We know that apart from the mosquito nets and the treatment, a lot has to be done in terms of indoor spraying, removing of the stagnant water, because that is where mosquito bleed. And that you can see the relationship between the change of climate in terms of rain and the upsurge of the disease. So one of the things I would actually really look at as the youths come on board, or rather as they have been, we need to look at the diversity of the campaign, telling the people that they are responsible for their own health, such that they make sure that the water, the stagnant water around where they are, the bushes, they are able to actually do it by themselves. Because it's very difficult for you to go to every village and be able to really address the things that are going to make sure that the mosquitoes are around. So one of it that, like the lady is talking about, is important that actually she's educated that indeed we can prevent that kind of disease that is attacking all of them. Apart from the mosquito, which she said that she did not get in the hospital, we can do other things. For example, the pushes around the homestead, the water, the stagnant, and because of that. Thirdly, the prompt response to the any symptoms that you feel, so that you can go and get the treatment. I'm glad that indeed we are seeing there's a lot of effort from the county governments to make sure that the diagnostic commodities and the treatment are in the hospital. So as we work, as I said, it must take all of us to really eliminate or to keep ourselves safe.
Okay.
So what we are saying as a government, you can see that the government is trying to do the campaigns, but then actually the most important is the ownership of the person who is affected. I'm glad, and I want to tell the people in Baringo that even when there are no mosquito nets, we can do other things that can make sure that they reduce the amount of mosquitoes that are around.
Okay.
Yes, the climate in terms of the leg swelling, it may not be possible for them to do, and that is why the government now is coming in with a project which I think you heard yesterday, talking about the Cuban project, where we want to actually spray the big body waters with larvicidal to be able to clear the mosquito larvae.
Okay.
Yes.
Dr. Eggers, of course, the other challenge is some of these mosquitoes, I don't know, are evolving or are becoming resistant to some of the insecticides we used in the nets that we've been using for a while. Is this something you've seen in other African countries?
Yes, certainly. So not only in Africa, but also in Asia, it is an issue that we have to deal with. So it is the best way to deal with this is really the preventative measures that we have. A malaria mosquito, even if it is resistant, cannot bite through a net. So sleeping under the net actually prevents the disease either way, if the mosquito is resistant to the insecticide or not. So it is really, really important that we keep our focus on these preventative measures, even while we research these resistant species.
Okay. Of course, I have to get your closing comments before we let you go. But just before we do that, let's get some feedback. We've been asking you to talk to us and be part of this conversation on our question of the day. This morning, we asked you, what is the progress? That is a question, of course, from Dev. We'll get to ask you that question in a while. But our question of the day, just before we take the feedback, was how can we completely eradicate this deadly disease in Kenya, which is, of course, one of the leading causes of death in Kenya. Let's get some of the feedback. And we have Dev. He says, Famis, he says, by donating free mosquito nets to every Kenyan in affected areas, of course, that's how we can end, of course, eradicate malaria in Kenya. We have Dev. He says, what's the progress of the malaria vaccine that was being developed by Kemri and Oxford? How soon will such vaccines receive authorization. Thank you, Dev. We'll be getting a response to that in a short while. Clara says, doing away with the breeding grounds for mosquitoes. Thank you, Clara. And lastly, we have Pierre Blaise. He says there's no need to have a kitty from the national. There's need, to have a kitty from the National Treasury, specific in fighting malaria, especially in areas well known to have this phenomena, namely lake regions, coast, and some highland areas. And of course, one of the takeaways from the feedback we've received, of course, is the issue of vaccines. And this has, of course, been ongoing in some parts of the lake region in Western Kenya. And in the last few days, of course, we've seen a breakthrough of a vaccine that has 77% efficacy that was reported, I believe, in Burkina Faso. And just before we let Dr. Eggers go, Dr. Eggers, talk to us about this breakthrough and what it means to the fight against malaria.
So any new vaccine development in the malaria realm is very welcome. So we welcome this announcement that was recently made about the efficacy of the vaccine that was being tested in other parts of Africa. So they have to go through the same trials, of course, to actually check the efficacy, make sure that it actually works, and seemingly it does work. It seems to have good figures. We need to make sure that it's safe. And of course, this vaccine is still in the early stages of its clinical trial. So the completeness of trials have to be done, and then it has to go, in WHO understanding, it has to go through a recommendation procedure so that WHO can recommend it. So WHO spends a lot of time then looking at the data independently, assessing the data of that vaccine, and then judging if this vaccine should be taken up globally and giving its recommendations on that. But I think any vaccine development is good news in this field, so we actually are quite happy to hear this.
Okay.
There was a question from your viewers about the about some Kemri Oxford vaccine, and I'm wondering if this is not being confused with a COVID vaccine. So currently, the two vaccines for malaria that are out there is really the one that's been tested here in Kenya, the RTSS vaccine, which we've spoken about, and is also quite effective. And then this new announcement that we've recently heard of Burkina Faso.
Okay. And of course, 77% is above the threshold by the WHO. I believe it's 75% for this malaria vaccine. What does this mean? Is this our biggest hope out of this fight against malaria?
I think it means that there is another weapon in our arsenal. There's another means of preventing this disease. As I said, we need to go through the full procedures to see that all the figures check out and the safety is there. But if in fact it is 77% efficacious, that is good news, and we should actually progress and move ahead with this vaccine as best as possible. Ultimately, it becomes one further step in this road to elimination, together with all the other engagements, be that treatment, be it bed nets, be it diagnosis. All of them come together really to bring to end the elimination of this disease.
All right. Of course, many thanks, Dr. Rudy Eggers, the World Health Organization representative to Kenya, of course, joining us as part of this discussion. He has to leave, but we have to go for a quick break. When we come back, of course, Dr. Pacifica Onyancha, the Director of Medical Services and Preventive and Promotive Health from the Ministry of Health, Chris Getonga, the Chairman of the End Malaria Council, and of course, Roy Sasaka from the National Youth Council Against Malaria are staying in this conversation after this quick break.
To achieve great things in life, you must do little things every day, like the 1, 2, 3 with Colgate.
1, wake up, wake up.
123 with Colgate and give yourself a future to smile about.
Salad vegetable cooking oil is the clear-flowing secret to tasty meals. Buy 5 liters of salad vegetable cooking oil today and get 250 grams Zesta tomato sauce for free. Iflo Kama Salad. Salad vegetable cooking oil. Available in all cooking outlets countrywide.
Make is the bride.
Get 500 MB free kila siku and never miss a moment.
These flags are representing the people that live in Philadelphia.
To make it in America, you need to be focused, steady, you need to be consistent, you need to work.
My Swahili is still pretty hopeless. Jambo Bwana, Missouri Sana.
You can take an African out of Africa, but you can't take out the African in them.
The experience in Kenya has been a great one. It's been positive. The weather is great. It's like our home city in Nigeria, which is Jos.
I watch Daring Abroad. Congratulations for what you do.
Try Panadol Advance for relief from headaches, body aches, and fever. With Panadol's Optizorb formula, the tablet gently breaks down in the stomach, quickly absorbs, and starts providing pain relief in 15 minutes. For fast and effective pain relief that you can trust, try Panadol Advance.
You're watching Your World on NTV Kenya this morning. Of course, thank you for staying with us. I still have Dr. Pacifica Onyancha. She's the Acting Director General of Medical Services, the Ministry of Health. Chris Gitonga is the Chairman of the End Malaria Council, and also Roy Sasakatelewa is the National Youth Council of Kenya, of course, joining us virtually. We continue that discussion about malaria. And just before we do that, let's give you a quick update on this story from, I believe, Bungoma County. And April 25th is the World Malaria Day, a special day set aside to celebrate the gains made in the fight against the disease. But even as the day is marked globally, here in Kenya, it is emerging that healthcare workers still need further training on the management and detection of severe cases of the disease, especially in children, in a bid to curb the rising episodes of acute malaria in Western Kenya, as my colleague Ouka Okusa reports.
6-year-old Purity Nafula is a survivor of severe malaria, which is gradually and worryingly gaining ground in Western Kenya. In October 2020, the little girl was rushed to hospital, exhibiting malaria-like symptoms.
Kaona alikuwa analalamika joint, kichwa, anatapika na miguu, joto mwilini, na hata miguu ilikuwa inatoka jasho tu.
But when tests were conducted on blood samples collected from the child, no malaria parasite was detected.
Na waliona mtoto anatapika, ako hali isiyo mzuri, wakamrasa kitandani.
The clinical officer who attended to the child at Mechimeru Health Center recommended admission and put Purity on antibiotics. But 2 days later, and with no improvement, Abigail Kakai, a trained severe malaria expert, prescribed another malarial test, which came back positive with 30,000 parasites.
So we started the patient on Artesunate, day 1, first dose. After 12 hours, we gave the second dose. After 24 hours, we gave the third dose, but the patient improved on the second dose.
Purity's case was a wake-up call to Abigail and her colleagues, who are yet to undergo the severe malaria case management training conducted by Impact, a non-governmental organization targeting medics in Western Kenya.
Because we know we do not have enough adequate resources to train every healthcare worker. So we complement trainings with mentorship, where we come on the ground, do ward rounds with health staff, do on-job training activities. And most of the work that we do is mentorship to just ensure that we reach out to every healthcare worker.
Such platforms, according to statistics gathered from Mechimeru Health Center, have contributed in bringing down the number of deaths resulting from severe malaria complications in the region. Ouko Kusa, NTV.
My colleague Ouko Kusa, of course, with that story from Western Kenya, which happens to be part of those high endemic areas for malaria in Kenya. Let me start with you, Chris. This region accounts for 70% of, I believe, our malaria cases in Kenya. And earlier on, we mentioned the progress that has been registered in the country. Are we seeing progress from that end?
Yes, I think we are, and I just want to go echo what Roy was saying earlier.
Yeah.
With the youth army, if we're able to go out there, and like Dr. Nyancha said, it starts with us, to help clear all the bushes, to be able to spray the larvicide on the waters, I think we'll start seeing even more progress.
Okay. So are we seeing the progress that we need to see in this 8, high endemic counties?
Well, I would say maybe Dr. Nyancha is best placed to answer that.
All right. I'll come back to that. But just before I let you go, then, there was the issue of the vaccines that we were trying. Of course, not the one that we have in Burkina Faso. There were ones that we were trying in Western Kenya. Do we have any update to that, or should I just go to Dr. Onyansha?
I think Dr. Onyansha is still best placed to answer that.
All right. Of course, the ball has been thrown to your court.
Let me start with the first question, whether we are seeing progress. And that clip from Bungoma actually tells it all.
Yeah.
Even as we have a lot of campaigns, a lot of strategies, we also must have the right human resources, the expertise to manage, especially case management. And I think as it has been demonstrated that it's good to invest in these people so that they can be able to know how to manage the cases properly, those who have actually been infected. Okay. Remember, the campaigns, the other strategies is actually prevention, but even in the best environment or the best strategy in prevention, there are few who would finally get the disease, and also the management, the case management really would determine the outcome, which for me in this time, we've seen that it's very important that we actually invest a lot in training healthcare workers, both the formal training, on-job training, and even mentorship, which really has gone a long way to help. Secondly, one of the things that is coming out that we have mentioned about, that as a government, we cannot manage alone. So there's a lot of partnership, and we really appreciate the public-private partnership. You heard them mention that the treatment, the training is by Impact. This is one of our partners that help. So coming to the second part, a lot has actually happened since we started the vaccines in 2019. If you look at the statistics, like we have reached about 190,000 plus children who have gotten their vaccines at different levels because of they get them in stages 6 months, 7 months onwards. Yeah. So we are making a lot of progress, and this actually, the actual impact will be demonstrated even when we do the next malaria indicator surveys. Okay. So with the interventions that I've had before, that is why we were able to celebrate the reduction from 8% to 5.6%. I want to believe that despite the other interruptions like the one for COVID, we will definitely come out better because we are improving or adding to interventions that were there before. Okay. Victor, remember I told you that the fight against malaria is not just using one intervention. There are many interventions which we need to actually bring out very clearly, that we are not just going to talk about only mosquito nets. Even the proper management of those who have been affected is one of the good intervention. The use of what we call indoor spraying is also very important. The other one is actually to make sure that we are able to eradicate the mosquitoes in the big body waters. A project that I'm glad that actually has come because the government of Cuba and the Kenyan government entered into a 2-year project to actually learn from what happened, because Cuba was able to use the same method way back in 1973 to actually eliminate malaria. Okay. So that partnership and many others. What the importance of this year's World Malaria Day is actually that part of involvement at personal level, that you have a stake in this management of malaria, no matter where we are.
Okay.
In terms of resources, because if we avail resources, and I am happy with the Malaria Council now bringing on board actively the private sector. Secondly, harnessing on a very important resource, the youth. You know, the youth with their energy, there's a lot they can do for us in terms of campaigning, advocacy, for people to own actually the various strategies that are set towards malaria elimination. And lastly, of course, the funding. The private sector also is going to help us in resource mobilization, which is one of the key strategies that is going to help us to bridge the gap. You remember the 24 billion? So we are very glad that we are in the right direction towards fighting malaria.
And I'm just, I'm about to go back to Chris on that bit about the 24 billion. But just before I do that, we were the first, I believe, with Ghana and Malawi to try the vaccine that is now in Western Kenya. And I believe there are plans to have us be part of the other countries to also try the new, more effective vaccine in Burkina Faso.
You see, Victor, when the vaccine, as you heard Dr. Hager said, it has different stages. We are glad as a country that we were chosen to be among the first one to actually see the impact, the outcome from the vaccines. And I want to believe that it's going to be, the result will be very amazing, and it will inform actually policy globally where there is the malaria. And so even the one in Burkina Faso, then it is going to go through the same stages to be able to really confirm and see the amount, the efficacy. Okay, we've been told it is 77, but then now it has to go to a larger scale, which is a really part of the vaccine stage in development. So if we find that the one we are using probably is less, then we can adopt the other one. So we are open, because really anything that works, we are ready for to use it with all the support. I'm sure the government is not closing. They are actually listening, and they are ready to really go ahead and do something.
Okay.
Yeah.
Chris, 24 billion, that's a massive resource gap.
It is. It is.
What does this mean? Because we have targets, I believe, for the malaria, I believe the Kenya malaria strategy for 2023, and others, of course, in line with the sustainable development goals, and most of them are actually reliant on how much resources we can gather to sustain the fight.
Yeah. So as you're told, our president Uhuru Kenyatta is the chairman of the Malaria Alliance in Africa, and he has really tasked the End Malaria Council to be able to go out to private sector. We're talking about the telcos, the banks, the big multinationals, the manufacturing companies, to be able to see that malaria is a problem that has been with us for many, many years. And like Dr. Ega said and Dr. Anyanja said, it is something that can easily be tackled, but of course what we need is resources. And I'm appealing, when we do reach out to the private sector, please dig deep into your pockets. You can see we have very able scientists who have even now prepared even malaria anti-testing kits. You can see the use of nets, and people have been told how to use it properly. Will really be able to reduce, if not eliminate, this dreaded disease over the next couple of years.
Yeah. Okay. And of course, you're fairly new. Of course, the council is fairly new. You've been there for, I believe, should be a year. Okay.
2 months.
2 months. 2 months. Yes, okay. Yes. And of course, and I think Dr. Pacific has mentioned that it is not a government alone, kind of thing. It has to bring everyone on board. For the 2 months that you have been, of course, trying to reach out to the private sector, have you seen any positive response?
Okay, over the last 2 months, we as a council have spent time trying to understand the disease, understand the needs. We're in the process of forming the legal entity that will then allow us to go out and raise funds. So very shortly, we will be reaching out to you once we are able to legally accept money, deploy it, and be able to give a scorecard of how it is being used. And like we said, transparency is very key to our agenda. And to also encourage, especially private sector, to be able to manufacture some of these needed malaria commodities in Kenya. We're talking about nets, we're talking about kits, which Camry are currently doing. We're talking about training. The president was at the NYS just the other day and was very, very encouraged that the NYS is even looking at commercializing some of its things. Roy is in charge of the youth army, will be very, very instrumental in this fight against malaria. But he also said his people will need some sort of stipend to go out every single day, clear the bushes and do that. So very soon we will be reaching out to you once we are formally a legal entity. And I think we will see results very fast. And I think the press, you will be able to also let people know what we are doing, encourage people to come and support us.
Okay. Let me just go back to Roy on this part. Roy, we are talking about being inclusive and making sure the youth become part of this. And I think in 5 years, in 10 years, the same youth who may not be so keen on participating in this fight today will be the ones sitting in boardrooms, will be the ones, making approvals for this vaccine. Talk to us about the importance of starting the journey with them right now.
From your words, I can see you're also passionate at what is inclusivity and the participation of young people, and that is really encouraging. When you look at this journey that we are talking of fighting malaria, actually where we sit as National Youth Council, we are looking at beyond inclusivity and participation. We are looking at young people actually leading, owning first of all the cause and leading the campaign. So at the forefront, because we believe when you say 10 years down the line, we don't look at the 10 years, we say, actually, we are creating the future for the young people. So even if youthful stage is a transitional stage, at any given time, we will still continue having young people. So the youth of now is we have our own responsibility and the burden of leadership to create that future for the youth of tomorrow and the one that is coming even after me. And we believe that there are some leverages we have as young people which are unique to us. First of all, is our appetite to our high affinity to digital in the digital space in terms of creativity, in terms of innovation. How do we leverage on the digital space in terms of communication? And we're also looking at, in terms of our demographic dividend, how do we use those numbers to sustain the campaign? When you look at the clips that were run earlier, I was encouraged to know that some of them, people were able to realize and be able to know the symptoms. And that is actually the first point where of fighting the war against malaria, by identifying what is this animal, what is this disease we are dealing with, what are the symptoms, how do we prevent it, and how do we cure it. So the first fight actually is to enhance sensitization campaigns in our communities. And that is we will leverage on the energy of the young people to push that campaign. And then just also to look at the success stories in terms of involving young people as we push for now young people leading the campaign, is look at some of the programs that the government has rolled out, which actually we were at the steering committee and we were championing for, like Kazi Mtaani. I know I may want to challenge our CS actually to conduct a survey or a research on how the Kazi Mtaani has also impacted positively in actually fighting malaria. Because we had young people opening up our drainages, we had young people clearing bushes, we had young people actually engaged in draining stagnant waters in our communities. And it was a very successful project that was rolled out in many counties across the country. So maybe what is there is that we've not gone further to see what was the impact of such a program, the National Hygiene Program, to actually eradicating malaria in our communities. So yes, Victor, as young people, we have the energy, we have the resilience. And also one thing, maybe just to, as I comment about the involvement of young people, is how do we build resilient communities? And these resilient communities, the demographic factor again, is the young people. We can only do this by also training those champions, those youth armies. And we are ready as National Youth Council, of course, with the support of our Ministry of Health, of course, with the council, the Malaria Council, led by my co-panelist, and also with the entire ALMA community, to build and train these youth armies in terms of malaria youth armies, so that then these can be the people who are leading the fight at the forefront. We want to be the leading at the front, not at the back, Victor. And thank you for acknowledging that. And I just want to thank my fellow panelists, because when you look at Dr. Onyanja remarks again, it is just, this is a call out that it is our own responsibility as a nation, as individual citizens, to fight and end this disease, and that yes, sure, we can win it. And we can also leverage on this energetic, youthful team that we have to fight and end the fight. Thank you, Victor.
Actually, Roy, on the bit about playing an active role and leading from, from the front and not from behind, I know you mentioned the issue of Kazim Tani, the youth slashing and clearing the bushes and draining the swamps and all that. But when we talk about inclusion, sometimes it also means meaningful inclusion. We want to see these young people, leading. Even Dr. Onyancha would agree in terms of developing this malaria vaccine that we are talking about, leading in the advocacy that, Chris has been talking about.
Actually, Victor, when you look at the participation of young people and leading at the front, we have so many avenues besides advocacy that I believe we are going to add much more value. Yeah. In terms of research, in terms of innovation, in terms of decision making. And I just want to applaud Dr. Onyancha because previous discussion, she has also been talking of how is the ministry going to increase participation of young people at the decision table in this fight. And across all other programs the ministry is engaged in, and this is what as National Youth Council, and of course as the young people of this country, we've always been advocating for, to have that seat at the table, to also have meaningful engagement and participation, so that then our voice is heard. Our honest voice is actually being realized in our development agenda. So yes. The involvement of young people or participation of young people is beyond the engagement. It goes further to having a decision at the table. It goes further to even having a voice in the policies that are being formulated. And that's what even the legislations that come up. We also have seen the challenges in terms of the funding gap. How is the voice of young people in actually pushing for policies, pushing for funding in whatever spaces they are at, be it at the national level, be it at the county level, and even at the community level. What is our contribution as young people? Mm-hmm. And that's why, of course, together, if we synergize all these together as one community, we are going to build what we call resilient communities. Resilient communities not only against malaria, but even against the adverse pandemics that we are facing right now. Because what we are going through as a country, as a globe right now, is a pandemic, and in the fight and in the wake of this pandemic, we are realizing that it's time for us to build resilient communities, and it can be achieved by actually putting the youth at the forefront of these fights, and that's why we are calling creating the youth armies, not only in Kenya but across Africa, to fight and end malaria.
Okay. Dr. Nyancha, do you want to respond to that? Because the youth have a chance at the bigger table?
Oh, yes. As I want to agree that indeed, anytime the youth have a big chance. And you know, they are the energetic, the young ones, and the innovation, full of innovations. Given a chance, really, even the 24 billion will actually be reduced, even just in kind. I just want to go back, apart from that high table. Start from the community, as the lawyer said. Mm-hmm. Each youth comes from a family. So if actually you are empowered, you start from home. Charity starts at home. That even as you come out, what environment are you living in? What is it that you are actually telling the people where you are? And I want to say that as a government, especially, we have realized that the highest impact intervention is actually the primary health care at that community level, to be able to empower and create what Roy is saying, that resilient communities. Roy, it is easier when I understand what I am supposed to do at that level, and especially through the guidance of the so-called community health volunteers. You remember the case of, is it Bungoma? Where, yes, where actually the community health volunteer takes care of about 60 households, and he makes sure that if they have the nets, he's even going ahead, you know, part of the training, to make sure that those nets are properly used for this. Because you can have a net, put your net in such a way that at the end of it all, you even make it easier for the mosquitoes, because they are concentrated now, it is easier for them to even transmit more. So youths have a very unique chance and opportunity, both at the lower level, at the community, and at the table in decision making.
Okay. And of course, this raises a very valid point of that which we will talk about, and then after the break, about, you know, ensuring that we sustain these services even during the COVID-19 pandemic. And when most people are afraid of coming to hospitals, we cannot, you know, organize huge barazas to educate the people. That community health worker or volunteer is much more important.
Very much. In fact, if you look at the primary health care approach in terms of the community health strategy, we are empowering and training these community health volunteers to be all around, not just for one disease, but they are able actually to address the issues that malaria, TB, HIV, environment, you know, hygiene. And they even go ahead and look at issues beyond the Ministry of Health mandate, that in terms of the security, they are being used. So this is a very, very important, I call it high impact intervention, such that once you empower people to take care of their own health, it is more sustainable and it is cost effective, because actually prevention is less costly than leaving somebody to be sick and be treated. That girl who was jumping in Bungoma, I am sure the amount of money that was used to manage the severe malaria is so much than the one we could have used just to prevent that treatment. So what we have realized that the paradigm shift is from now more of prevention than cure. We don't wait for people to be sick so that we treat, that we make sure that we prevent disease. We prevent people from getting disease and promoting health. So that is why we're investing a lot in primary health care, and actually which the government has taken as the vehicle towards the universal health care. So that is, to me, it does not exclude malaria, and indeed we'll find that we have achieved more, that we may not even necessarily get need the 24 billion because of the approach of the primary health care.
Okay.
Yes.
Wonderful. Of course, we have to go for a quick break. When we come back, we'll be looking at the feedback that you've been sending us. And of course, we wind up the discussion with how we can sustain the fight against malaria in Kenya, especially at a critical juncture like right now when the coronavirus pandemic is ravaging economies and countries across the world. Don't go anywhere.
BBC's Smart Money program presents an exciting new technology segment dubbed Smart Tech. It features young African innovators who are developing inventions aimed at solving problems and challenges on the continent.
The problem we're trying to solve is to make solar panels more effective, no matter the weather or season.
In recent years, the cotton sector has undergone a renaissance in the Ivory Coast.
Today in the cooperative there are 800 people who work here.
The country is now one of the three main African cotton producers behind Benin and Mali.
Beat sensitivity pain fast with Sensodyne Rapid Action for clinically proven relief in 60 seconds.
Mzing ni aje? Nataka jo kujiuliza jamaa jo alidiscover jo sambu inafaa ikuwe na kona 3. Samosa. Imedu nini? Inakuwaga na kona 3 sana, shindwa kwani atadiscover ya kona 4 lini? Mzing zimekuraru. Acha hiyo triangle atafuta hata kama ni pentagon.
To get samosa, dial *811 *928#. Skiza na Nation.
Interrogating our financial behavior.
Why should we be putting so much in the village, very scarce capital, in assets which we hardly use? In fact, some of it is negative in the village.
going against the grain.
If, for example, you are a pensioner, there is nothing wrong with living in a flat in Gara, much cheaper, and in the event of death, we have spaces like Langata Cemetery.
And asking the return on investment question.
Our savings are then going into non-earning assets, then we are actually not doing a good service for ourselves and the generations to come.
The next edition of Business Redefined, we host the regional CEO of Jubilee Holdings for this and more.
Try Panadol Advance for relief from headaches, body aches, and fever. With Panadol's Optizorb formula, the tablet gently breaks down in the stomach, quickly absorbs, and starts providing pain relief in 15 minutes. For fast and effective pain relief that you can trust, try Panadol Advance.
You're watching Your World on NTV this morning. We're talking about the burden of malaria in Kenya and how we can move together as a country towards the goal of eradicating malaria completely in the country. Dr. Pacifica Wanyancha, of course, is still with me in studio. Chris Getonga and Roy Sasaka are still with me as we bring this conversation to an end. But just before we do that, let's give you a quick update from, of course, across the world. And Italian businesses are preparing to reopen their doors after more than a year since the start of the COVID-19 pandemic. For the first time since last summer, restaurants can serve customers on the premises, but only if they have outside space. And after 3 years of restoration, the famous altarpiece of St. George, dated to 1493 and attributed to the master sculptor John Bowman, returns to the Art and History Museum of Mra in Brussels. The masterpiece measures no less than 5 meters wide and 1.6 meters high and presents 80 meticulously detailed figures. Right, and you might not expect to feel close to nature traveling on a train through London, but just a few steps from the platform at Brunsbury Park Station and Energy Gardens is thriving, creating a microcosm of biodiversity hiding in plain sight. The solar-powered green corridors promote environmental engagement and offer communities the chance to grow and gather food.
Energy Garden is really about building resilience in communities. So it's not just garden or energy, it's about how do we directly address the climate change issue that everybody feels they are powerless to do, as vegetable growing, beehives, bat huts, swift nests, hedgehog houses, solar panels, and enough carrots and Jerusalem artichokes to fill your plate.
But it's also really nice to see the progress that you can make, kind of, visually. It's really satisfying to see the difference that, a few hours work.
I certainly didn't have any experience growing food, and I've been learning quite a lot over this period, and I think that's why it's good to just learn from others who've had experience in this work.
So I think it really is making London a better place to live. It's making it more pretty. People commute, millions of people each day. This enhances their commute. It's making the environment better because more plants means less carbon dioxide, and it's bringing people together. So I think all of those things are important for a huge city like London, where that often doesn't happen.
Right, and Luz Martinez has contracted malaria 3 times in Venezuela, the last time when she was 6 months pregnant with her 4th child in a low-income neighborhood. She lives in Los Montanes, a community in the outskirts of the city of Barcelona, eastern Anzoátegui state, where many residents fear malaria more than COVID-19, which has overwhelmed hospitals in the South American country.
Personas de la casa. ¿Oye? Eso venía en una bolsa concentrado. Si tú lo sacas... Ya la pones, la volteas hacia este lado porque la mesa está como así.
Yo lo meto para el colchón, ¿no? Pero...
All right, Dr. Onyanche, clearly, of course, the focus is on Africa because that's where the huge part of the burden is, but clearly it's not an African thing alone. That's Venezuela.
Yes, I think, and that is why we have the World Malaria Day. Otherwise, it could have been maybe African Malaria Day. Of course, when the African states realized that they were more affected, that does not mean that we don't have other countries which have got the same problem of malaria. So you have as you've just shown us, and as we talk about the fight, the countries, you say there were the 6 which were actually had a target, some did not meet. So we are looking at globally, and indeed it is the efforts, because after all, nowadays, you can have a mosquito coming from London, or coming from Kenya to London in maybe in 24 hours or less, and then it is carrying malaria. So we really need to be vigilant all through. So it's not an African problem, but it's more in Africa. And of course, as you know, Africa being a developing continent, so the resources are not enough and all that, and therefore it tends to be seen more, it tends to affect us more because of the constraints in terms of resources in actually implementing the strategies.
Okay.
Yes.
Of course, I have another question regarding drug resistance. But just before that, let's take this quick call from Mike. I believe he's in Narok. Mike, if you can hear me, please shoot your question or comment. Mark. Mark?
Yeah.
Go ahead.
Yeah, habari asubuhi.
Nzuri sana.
Nilikuwa naulizia kama hizo
kama Mark.
Yeah.
Naomba urudie swali tena.
Nasema kama Narok County inaweza kuwa mojawapo ya hizo county ambazo zitapewa hizo mosquito net. Nilikuwa nataka kujua juu sisi ni vijana tunatafuta hiyo kazi.
Okay. Unauliza kama Narok itakuwa mojawapo ya hizo county zitapewa neti? Aya, asante sana. Bila shaka tutajaribu kupata majibu ya swali lako.
Okay.
Asante sana, Mark. Of course, is asking about the issue of the mosquito nets. I believe, was it 15 million, or that's the value of the mosquito nets that are being distributed?
We are having 15.7 million nets, not worthy, nets themselves to be distributed. And if I heard this question well, is that is saying if Narok is one of them, and therefore the youths are ready to support the distribution of those mosquito nets. I think that was in the context, the way I had it. So what I can answer him is that whereas Narok may not be one of it, but as a youth, you can actually assist in any county because it's Kenya. We actually bring on board all the youths who are actually ready. There are some who will be data collectors, some will actually be involved in the actual distribution. So because we are Kenyans, you can work anywhere in Kenya.
Okay.
What Loy meant is that now the locally, the local youths in the various counties, they would be more, available and ready, but it does not stop any youth from supporting the exercise in whichever county.
Okay.
That is what I can explain.
Yeah. Okay. I know you mentioned earlier that the need to focus on preventing as opposed to treatment, because the other concern that I saw earlier on was, other than the mosquitoes being resistant to this insecticides, there was also an issue of our bodies sort of getting used to the only treatment of malaria that we have locally.
Victor, it's not the body getting used. It's actually the parasite mutating so that it cannot respond to the medication. And that is why our scientists are continually trying to actually understand the vector, the mosquito, the behavior, and it keeps on changing. And that's why you see us changing the treatment. We have the first line, second line, and all that.
Okay.
And we have that which you treat the severe malaria and all that. It actually depends on what the mutations that has taken place. If you remember, maybe the time we were very young, the drug called chloroquine was very, very prevalent, and you could find it anywhere. And because of that continuous, the vector was, the parasite was able to mutate, to just change, you know, that, so that it cannot actually be affected by the chloroquine. So it was withdrawn from the counters. And as time goes by, when that happens, then you have a different mutation of the parasite, which now responds to another medication. And that is why you see us changing. There were medicine, the chloroquine-based, the sulfur-based, and all that. And they keep on being changed because of courtesy to our scientists who are continually trying to analyze the behavior of the parasites.
Okay. And maybe now, as we walk towards the end of this conversation, we have someone who's watching right now. We are all so preoccupied with COVID-19 from a personal level, from protecting yourself health-wise, from how it drains your finances, and we almost don't seem to have time for malaria.
My request to the general public at individual level is that even as COVID is there, before COVID, there was malaria, there was TB, there was HIV, and many others. And the fact that COVID has come has not eliminated the other diseases and has not prevented you from getting the other diseases. And therefore, it will take a deliberate decision at individual level to be conscious of where you are. For example, the malaria endemic counties, we need to know that that actually is a bigger problem that we already have than the COVID that is coming. And therefore, we should not lose focus on first identifying the signs the earliest possible. Secondly, even before we are sick, we need to continually put in place the preventive measures, which the government is insisting, that when you are going to sleep, make sure that you are sleeping under a mosquito net. And in the absence of mosquito, I know there's a problem in terms of poverty, but at least spare a few coins to even purchase a net for yourself, if the one that the government is giving has not reached you. Thirdly, as I say, that seek prompt treatment when you have signs, and of course take the medications as you are advised by the healthcare worker. Lastly, of course, I want to say that at a national level or at policy level, we have not lost focus. Dr. Heggers did not tell you that even as we were responding to COVID with the many sub-counties that were formed, one of the committees, the committees which were formed, one of the committees that was very useful was that one of maintaining essential healthcare services, meaning that we had to actually tell people, we had to continually formulate policies and guidelines to make sure that the other essential healthcare services continue, lest we find ourselves, as he said, like West Africa, where more people were killed by the other diseases than the Ebola itself. And I want to believe that even up to as we speak now, we are not just putting all the efforts towards the fight against COVID, but we are still providing services for malaria, for TB, and any other diseases, including the non-communicable diseases, which is really a big burden. We are seeing an emerging burden now in our country. So I'm urging the public that, yes, as much as you are scared of COVID, it does not stop you from taking other measures that you've already been told before, together with the IPC, that is infection prevention control practices that we are emphasizing for COVID. Victor, I want to say this. We can do everything. We have got very good policies, we have got very good strategies, we can have the commodities available to fight against malaria and even COVID, but it takes an individual to take and perform your role. We call it sick role. We have just discussed with you that you can give somebody medicine, you can do everything, but until that person takes that medicine the way it's supposed to be, is not likely to benefit from it.
Okay.
We can bring up very good strategies, but unless the individual takes their own responsibility to actually do what is expected of them, it will just be a good policy, and that is it.
Okay.
Yes.
Of course, I'll come back to you with regards to the importance of taking a personal initiative. But to Chris, definitely the nature of COVID-19 means that we are all sucked into trying to stop the spread. So far, more than 2,000, I believe 300 people have died from COVID since last year. But malaria is some sort of a silent killer. I mean, in that very same year that we lost just above 1,000 people for COVID, there are 12,000 people who died of malaria. So from a resource point of view, can we afford, maybe as an investor, as the private sector, afford to put all our attention on COVID?
Well, like I said, and to answer what Dr. Ananja is saying, malaria starts with me and ends with me. It is the silent killer, a much, much more deadly killer than COVID. And I think looking at the resources that we need and what's available, the nets that you talked about, the 15.6 million nets to be distributed, are costing 8 billion shillings. So, and those nets also have a life of about 3 years. So just to let you know that is why we're looking for these resources and these funds to be able to keep the nets being replenished every year. I think it's about 5 million every year. And I think Kenyan people will be able to spread their resources between the pandemic and malaria prevention.
Okay. Let me just go to Roy. Dr. Anyancha has mentioned, raised the point about all of us being a part of this. But we have also mentioned in this discussion that, you know, malaria is endemic to the lake regions and the coast region and areas like Baringo and Turkana. And I'm a young man in Nairobi, you know, in my 20s. Why should I care?
Thank you so much, Victor, on that. I like what Dr. Onyancha said, that it's our own personal responsibility, irrespective of where we are, what we are involved in, to actually take part in this fight against malaria. If, as a country, we are to actually draw the line against malaria, to make sure we actually get the zero we are looking at. So I like her energy that irrespective of where we are, because we all are serving this country irrespective of where we are. So yes, as young people, we need to be ready to serve at whatever place we are, and take part in actually building these resilient communities. And as as the discussion goes, I see that we all have a responsibility as young people to take part in building back better, especially in creating those resilient communities in wherever we are. So I totally agree with her that first, let's of course play a role in our communities, but let's not restrict ourselves to only the communities we are coming from. Let's make sure that wherever we can take part and have an impact, let's do that.
Okay. I think I have a caller, is Lettingson from Nairobi. If you can hear me, please shoot your question or comment.
Hello.
Yes.
Habari ya asubuhi.
Mzuri sana.
Nafuatilia hiyo mahojiano.
Yeah.
Kuhusu hiyo state of malaria in Kenya.
Asante.
Swali langu.
Yeah.
Iwapo sasa hiyo vaccine ya malaria imepatikana.
Yeah.
Na malaria imekuwa ugonjwa hatari sana kwa muda mrefu.
Yeah.
Mikakati gani imewekwa na kama hiyo tiba yake ambayo imepatikana kama inaweza kuwa mahospitali sote aswa zile za serikali ndio kipatikana shida hiyo ya ugonjwa, na tiba pia inaweza kupatikana kwa karibu na kwa wakati ambao unafaa.
Okay. Asante sana Dr. Onyancha ataweza kujibu swali lako. Asante sana Livingston.
Okay.
All right. Did you hear him?
Yes,
I
I
think
did.
the question was, how can these vaccines be available in all public hospitals?
Okay, thank you so much for your question. You want me to say in Kiswahili or just in English?
Yes,
okay.
yes.
I think what I want to say is that the vaccine that is in the country, the malaria vaccine, as you heard, it's only in 3 countries, and actually it is at that stage of where we want to see how much can it prevent malaria. So it is not yet for everyone, and so where it is being deployed at the moment are actually the high endemic areas. You heard the head of the malaria program say that we are having that vaccine in all public facilities where immunization is taking place in the endemic areas. So if is interested in the vaccines and it's being given to children, and they said we have already reached a target of about 190,000. So we already have it. It is actually part of the routine immunization. Just the way the child goes for measles vaccine is the same way they are going now for malaria vaccine, but only in the malaria endemic areas.
Okay.
So you may not get it, for example, in Central.
Okay. And maybe then, do they know how long they need to wait before this thing is available in all public hospitals?
Yes, actually, as I said, the 3 countries in the world that are now giving the vaccines, they have a period through which they will do analysis and actually collect data and be able to see what is the impact, and then it will be even scaled up now, not just for Kenya, but even for the other countries that are suffering from malaria. You have just seen that it's not a problem of Africa as a continent, but it is actually all over. So the area where there's malaria is a problem, the vaccine is likely to be scaled up to those countries. And at that time, even in malaria, as you said, in Kenya, it will be given where it is most needed. And what I have not mentioned is that even as we work towards elimination, there are some parts of the country which have actually reached where we can talk about some national elimination, where malaria is not a public health concern. So for us, that area may not be the first place you want to take your vaccines, because it is not a problem.
Okay.
Yes.
So in any case, if they were, some sort of an independent, isolated country, they would qualify to be, declared as the countries that have been declared, I believe, malaria.
Exactly. And in fact, at one point, as going forward, even as we work towards elimination, there is the thinking that we might actually be having what we call subnational elimination, so that we can say we have actually eliminated malaria in this part of the country. So as we work, it gives you a lot of hope that, yes, we can actually reach there.
Okay.
And I think, Victor, as you have seen, a lot of effort is being made. You just read statistics that indeed we are coming down. In the endemic areas, the incidence was 27%. We are now talking about 19. That is, for me, good progress. So when we come, there's a level that we reach until it's not a public health concern, and therefore that is actually as good as elimination.
Okay.
Yeah.
All right. We, of course, have to wrap up this conversation. Roy, let me just start with you then. Myself and other young people like yourself and other, other young people, I believe 70% of our population actually is somewhere below 35 years. We have access to resources that our parents did not have. We can talk about social media. We can be able to, talk about the issues of internet access, smartphone access, mobile penetration, and we can, for the first time than the other generation, we can reach as many people, of course, than would be reached by the other generation. Talk to us about the importance, of course, of the youth, first of all, leveraging this demographic dividend, as well as, the resources that we have at our disposal to make sure that we actively participate in fighting malaria, but also have a meaningful participation.
Thank you so much. When you look at it, Victor, that discussion also answers Dr. Onyancha's concern in terms of, do we actually need to be Narok for us to participate in the fight of fighting malaria? Or even at the comfort of my home in Bungoma or in Kisumu, I can participate in this campaign.
Yeah.
And when you look at it, especially as young people, we can leverage on social media, that is the digital space, to actually build a very serious, resilient youth army. And that's why that is actually the genesis of building the resilient youth army across all spheres, be it at the digital space or at the community space. And that's why we are saying our role, first of all, a quick win. You know, you look at the low-hanging fruits. The low-hanging fruits for us as young people is, of course, the advocacy in terms of awareness creation. How do we create awareness creation about, especially in those communities that are affected with malaria, in terms of prevention, in terms of what are the things we need to do? What are the responsibilities of me as a young person or as a citizen? So I believe as young people, we can leverage, of course, in the digital space in pushing up this campaign. As we are speaking right now, even as National Youth Council, we are leveraging on the digital space to make sure that young people are not watching NTV right now and on the social media, be it Facebook and all that. As we commemorate this World Malaria Day, as we continue the discussion, are getting access to this information. And we're actually challenging them to push this discussion across all those social media spaces. So yes, I believe that as youth of this country, we have the digital space, we have the energy, we are very creative, we are very energetic. Even as you listen to Mark, he's already ready saying, are you guys coming to Narok? I'm ready to join the advocacy campaign to actually make sure that this information is not only limited to one area, but can be accessible to every other young people in the grassroots. And as I wind up also, there is also the need to engage young people at the grassroots. And that's why we normally at National Youth Council use what we call Fursa Mashinani. Fursa Mashinani, Fursa is a word that means opportunity. Where are those opportunities for the young people at the grassroots? And that's why I was very keen to say that as we also push the discussion and we leverage on the available digital avenues online, we also have a leverage to use on also engagements at the community level. Yes, I know COVID has brought challenges in terms of our community engagements, but beyond COVID, we are looking at even having very robust Fursa Mashinani activations in building the malaria youth army, as we say, engaging young people at the grassroots. Thank you, Victor.
All right. Chris, we have definitely made some good progress so far, but we're still losing more than 12,000 people to malaria every year. And maybe from a resource point, we definitely need every coin that we can get, don't we?
Yes, I agree. And that's why I said when we hit the ground running, we hope we get all the support that we require. You've heard from Dr. Onyancha. We have all the resources as far as human capital, the doctors from Roy, he has his army ready. So we're just waiting to approach all our partners to reduce this number to 0.
Okay. All right. Dr. Nyancha, let me just finish with you. Definitely, Chris has talked about the campaign that they are doing to raise resources. And Roy has spoken about what they are doing to make sure that the youth are involved in this. And all those may not be enough. The doctors on their side are doing something to do with developing the vaccine. And of course, again, that may not be enough. What will be enough in, of course, fighting and eradicating malaria in Kenya?
Wow. What will be enough? All those together. But I still want to emphasize the issue of taking personal responsibility at that individual level. Secondly, investing more in the preventive aspect than the treatment, the curative. And also, finally, the prudent use of that resources, because they are not unlimited.
Okay.
What do I mean? That indeed there should be a deliberate move of what we call integration. Integrated services, meaning even as you respond to COVID, you will still use the same resources to actually address issues of malaria. And in so doing, you will actually be reducing even that resources of the 2 billion. Because, for example, if we have very good trained healthcare workers, as they respond to COVID, it's also their responsibility to respond to malaria in almost equal measure, so that one is not left. The same infrastructure that we have actually maybe increased or improved to respond to COVID, then it is going to be the same infrastructure that we will be using in malaria. So for me, even COVID has come, sometimes we look at it as a blessing in disguise. Roy has mentioned about the issue of the ICT platform. Nowadays, you can have so many meetings. You can have training virtually, which actually could have taken more resources to train, especially the healthcare workers. So even as they go for campaigns, they may not be there physically, but using the platform, as you have just said, they are more likely to reach more, even as they do the youth army for malaria. For me, because most young people actually are IT in compliance, they are likely to even have it even easier than during our days when we were growing up. So for me, that, as you say, it's not enough, but it is that effort, one here, another one there, that will actually help us to fight and win the war against malaria as we draw that line. Remember, the last year's theme was the zero malaria starts with me. It doesn't just start, but it will start and end with you. I want to urge the public that even as we are going out to start on 30th, the mass net distribution, it is one thing to distribute the nets, and it's another thing to actually use the nets in the proper way. I want to request that the nets that have been given, please make use of them, and indeed, in the end result will be reduction of malaria significantly.
All right. Right, and that brings us, of course, to the end of today's discussion. We've been talking about the malaria burden in Kenya and how we can, of course, move together as a country to eradicate malaria, especially at this period when we're also fighting the coronavirus pandemic. Many thanks to my guests, Dr. Pacifica Onyancha, the Acting Director General of Medical Services, Chris Getonga, the Chairman of the End Malaria Council, Roy Sasaka from the National Youth Council of Kenya on malaria, and of course, Dr. Rudy Eggers, the WHO representative to Kenya, who left the conversation an hour ago. Tomorrow, my colleague Gladys Kashanja will be joining you from 7 a.m. as she talks to you about your financial health, managing your finances, what you have to do, and the secret behind table banking, and also why you should save more. Thank you for watching. My name is Victor Kiprop. See you on Wednesday.